Hi everyone, welcome to Lesson 5 on antimicrobial resistance. So today we're going to be talking a little bit about what antimicrobial resistance is and why it's important to public health. And we're also going to talk about antimicrobial stewardship, and we'll have a couple of video clips by healthcare practitioners, and we will eventually lead into talking about some successes and challenges with preventing antimicrobial resistance from becoming a major problem. So ever since Alexander Fleming's penicillin discovery in 1928, antibiotics have been essential in healthcare for controlling infections. And shortly after penicillin was developed, there was a creation of other antibiotics such as sulfonamides, cephalosporins, macrolides, and more. Um, it's also important to note that many of the newer generations of these antibiotic classes are of a broader spectrum. So they don't target only specific strains of bacteria, but they also target bacteria that aren't necessarily bad bacteria. And this is why antibiotic resistance can become a major problem. The issue is that no new classes of antibiotics have been created since the 1990s, so this is actually a major public health threat because if more antibiotics become less effective, infections that were once treatable may in fact become untreatable once again. So here's a little diagram that I like that explains how antibiotic resistance works. So usually few germs are drug resistant, and antibiotics will kill the bad bacteria, but they'll also kill off some of the good bacteria. And some of those drug resistant bacteria are allowed to grow and they take over, and then some of those bacteria with those genetic resistant strains can actually spread those genes to other bacteria. So that is how antibiotic resistance is perpetuated. Although there are many different ways that antibiotic resistance can prevail, such as using antibiotics in livestock, for the purpose of this presentation, we will be focusing mainly on infection control within hospitals. So this refers to antimicrobial stewardship, which we are about to get into now.
Hello, I'm Dr. John Ostrowski. I'm an orthopedic surgeon and chief of orthopedics for Niagara Health. I do a fair number of elective total joint replacements and as such take surgical site infections very seriously. We give prophylactic intravenous antibiotics to prevent surgical infections. Several years ago, there were a number of outbreaks of Clostridium difficile infections at hospitals across Canada. This was a very serious problem, and there were a number of fatalities involved. We know that certain antibiotics and inappropriate treatment regimens make people prone to this very serious and possibly fulminant infection. We learned a great deal from these outbreaks, and as such, we're very cautious with our use of antibiotics in terms of the choice of antibiotic, dosing, and duration of treatment. In particular, we tried to limit the use of antibiotics that make people more prone to this infection, such as clindamycin. In doing so, we're able to limit the incidence of surgical site infections, and for the most part, we have been able to prevent outbreaks of Clostridium difficile.
So antimicrobial stewardship, it's a method of ensuring that in a hospital-based setting, every single patient who is at high risk gets the right medication and dosing that they should be getting based on their condition. So for example, if a patient had a UTI and they didn't have a culture taken and they were being given the wrong kind of medication, antimicrobial stewardship would make sure that they're getting the proper medication.
Hi, so my name is Dr. Karim Ali and I am an infectious disease physician with Niagara Health. I am also intricately involved with antibiotic stewardship program here at Niagara Health. Antibiotic stewardship program with Niagara Health was started back in March of 2013 with select and we selected St. Catharines site as our primary site. Period. This was developed in conjunction with Dr. Jeff Powis from Toronto East General Hospital. Period. The the strategy we used for antibiotic stewardship is called prospective audit and feedback, where myself or another ID physician in conjunction with an antibiotic stewardship pharmacist reviews all patients with selective high-risk antibiotics, and basically what we provide is what's called prospective audit and feedback. So once we have reviewed it with our pharmacist, we go ahead and give feedback to the most responsible physician about the appropriateness of the antibiotics and duration of antibiotics, and whether or not we can convert this antibiotic from intravenous to the oral formulation. Antibiotic stewardship has now been realized as a national, and with WHO's collaboration, it's been now determined to be a worldwide concern because of the emerging resistance in multiple gram-negative organisms. We have seen this over the past years, and what has been determined is unnecessary and inappropriate use of antibiotics is directly correlated with resistance. And in order to reduce the rates of resistance, there are certain strategies that are needed to be pursued. One of the most important one is antibiotic stewardship in the healthcare setting. So I'm talking about inpatients and outpatients. So all of us need to be antibiotic stewards. Here with Niagara Health, it gives me tremendous joy to say that we have made a lot of progress. There is still some work that needs to be done, but overall this has been well received, and it has led to this collaborative effort where everyone is responsible and everyone is equally important in making healthcare decisions.
So just as a quick debrief, we do know from the evidence that antibiotic use, inappropriate antibiotic use, is one of the main drivers of antibiotic resistance. And we can see from the evidence that many gram-negative pathogens have actually shown an increased prevalence of antibiotic resistance, and this is directly correlated to prescribing antibiotics for those pathogens. So after talking to Dr. Ali, I was able to sort of pick out a few key challenges with antimicrobial resistance. So one of the main challenges is that it's very difficult to define antibiotic regimens. So it's very difficult to tell what a full course of antibiotics is. Another issue is that antimicrobial stewardship, unfortunately, is beyond the scope of primary care. So an issue with that is patients often get prescribed unnecessary antibiotics, or there could be compliance issues, but unfortunately the stewardship program cannot address this. Another issue is that bacterial cultures are not always taken in a timely manner, so broad-spectrum antibiotics may be more likely to be used, and this is a problem for resistance. And lastly, it's also very difficult to track these resistance patterns in the grand scheme of things, so really it could take decades to figure out if we're really making a big difference in terms of antimicrobial resistance from the bigger perspective. So lastly, some successes are as follows. So for example, for primary care, Public Health Ontario has some guidelines listed for prescribing physicians. Also, for acute care, antimicrobial stewardship is good at the ground level and front line. So there has been some very good collaboration for disseminating results. So there are quarterly reports, and data that are frequently looked at to make sure that your changes are really an improvement. And lots of evidence actually supports that antimicrobial stewardship has been working, specifically within the NH. So they have had many gains so far. Mortality has improved from the start of the antimicrobial stewardship program until now. So that was my little overview on antimicrobial stewardship. I have attached a few different resources within this lecture here for you guys to take a look at. I hope you guys enjoyed my lecture. Thank you for listening.